Audio Jungle. Audio Jungle.
Okay.
Program manager of Pilipinas Shell Foundation.
Okay. Ma'am, can you give a little bit of yung parang what's the project all about?
Actually, series of projects. It's
Series
not
of
just one
projects.
project.
Okay.
So when we started the program here in Palawan, we started with Kilusang Ligtas Malaria. As you all know, Palawan has the biggest burden of the disease in the entire
Because of the
Philippines. And so when we started it here, right away the cases went down because of mass education. Then we also put in the early diagnosis and prompt treatment. So because of that, we were able to get a lot of funds from the Global Fund. And so when our small project in Palawan became national. So when we started nationally, the project was about, it covered the entire burden of the Philippines was 58 provinces. Throughout all of these years, we are now negotiating the last grant from the Global Fund. And it's now just 8 provinces that are reporting malaria.
Sabi, bumaba talaga.
Unfortunately, Palawan pa rin yung
Biggest.
biggest. But if you look at Palawan, we started the malaria program with about 58,000 cases, probable cases in Palawan. And last year, it was just 6,000.
Okay.
So the drop is almost 90% on cases. So that, I think, is such a big accomplishment. And then the case and the death for caused by malaria went down to about 96%. So talagang sobra yung impact. But because of the program of malaria, we were also able to see the other inadequacies at the barangay level. So from the lack of knowledge and capacity building that was needed for the barangay health workers. So we did all of that. And then we looked at the indigenous people. And so we did a lot of integrated support to indigenous people, not just providing them with access to energy, but providing them with the livelihood. In partnership with the Department of Health, Department of Education, we also provided the access to alternative learning schemes and scholarships for the children. Of the IPs. So we did not only look into livelihood, we also looked into their health. So the process of helping them improve their health, because the delivery of services in the IP communities is so low, by putting the access to energy, we've actually increased the level of delivery of services. So in the past, when you don't have services in the evening for diagnosis, now with the lights on, you can actually have diagnosis. And when they were having difficulty doing the maternal, providing birth, diba?
deliveries.
The traditional birth attendants now are actually able to do the safe
Mas safe na
delivery
po.
of children with the lights on. Diba? So there's a lot of things that are catalytic because you provided them with the basic things that they need. And so Shell does not only do that, but it also does the ecotourism. So we've supported a lot of community-based sustainable tourism so that we encourage them to take care of the rich natural resources of Palawan. And by doing so, earning a living for themselves. So the people that were capacitated have become accredited, government accredited tour guides and whatever else that can help the tourism industry. So there's a lot of projects that are being done.
Okay.
And there's a lot of projects that have been done in the past. But I think babalik at babalik dun sa malaria
Malaria.
program. Kasi the malaria program seems to have the most impact in the community. When we looked at when we had the survey actually, 86% of the respondents said that they were affected by the
Mas naalala nila yung that project.
They know about the project. They know that
They can
have
relate.
Yeah, they can relate, and they know that they have been impacted by the project. So, nakakataba ng puso when you see that. So, yun nga yung sinasabi ko kanina. I've gone far and wide in Palawan to deliver these programs. Masaya na ako na nangingitian ako, masaya na ako na nayayakap ako, masaya na ako sa mga very good reception. So, I think the award tonight was really something that is even more kasi it's humbling to be recognized.
Nice.
But it's also fulfilling to see that, we have really impacted the lives of many people.
And touch the people of the Palawan. Ma'am, last
When you look at it, when you do something for the community, it does not only help the community, but it also helps the companies. So by working into the malaria program, we did not only help the entire Palawan and actually the country now, but also we made our employees safe. We made everybody safe to come to Palawan. So you did not only promote wellness among your peers in the company, you also promote a very good relationship with everybody in the community. So it helps to do some social programs in the communities that you work in because it shows that you care for them. You
and not
care
just for
them.
the
And so, yes.
business.
And so people actually appreciate that also. So it makes a lot of difference when you have a very good relationship with the community. And so you talk about things that probably they won't talk to you about if you were not such a
Closeness sa mga...
closely knit. So before problems erupt, nade-discuss na natin on the ground, di ba? So it makes a lot of sense to
Mas
do your
open na
social-
sila sa inyo.
Makes a lot of sense that the trust of the community is achieved. And therefore, when you have that trust in the community, then there are no problems in the operations that cannot be discussed by you in the community. So that you can mitigate any problems that are, even before they erupt, napag-usapan na ninyo, di ba? So, it leads into no production loss and the like. So, sa akin talagang kailangan isa yan sa mga ingredients ng operations to have a very good CSR in the